There are three important concepts that I want you to be aware of. This will frame our discussion. First, the fact that migraine is a primary headache disorder. A primary headache is a type of headache that occurs on its own. It's not a result of another medical condition. It's called primary because the headache itself is the main medical problem, rather than it being a symptom of something else, which would then result in a secondary headache. For example, a headache caused by whiplash or an infectious process like meningitis, that would be classified as a secondary headache. So for migraine to be a primary headache, by definition, it cannot be caused by neck pain. This is a critical distinction that forms the foundation of our discussion today. Second is that migraine is a long-term medical condition, so it persists between attacks. So if this is a migraine attack, this is a migraine attack, and this is a migraine attack, what happens in between these migraine attacks? It's still a migraine. This entire thing is kind of like a life cycle of a migraine, with these being migraine attacks. So migraine is a persistent neurological condition. It makes one susceptible to these attacks, and this isn't a new concept. This concept is similar to many other chronic diseases. For example, asthma, rheumatoid arthritis, ulcerative colitis. These are all lifelong diseases that have acute episodes of symptoms. These acute episodes may be triggered by various factors, but the disease itself is generally chronic and has genetic components, same as migraine. So when we are referring to migraine, we are referring to the migraine attacks and the interictal periods, the time in between attacks. A patient has a migraine throughout all of this, not just during the attacks. Third, and to emphasize this as its own distinct point, migraine is a neurological condition that cannot be triggered. It cannot be triggered. Well, you may ask, what do you mean? Of course there are migraine triggers. Yes, migraine attacks can be triggered, but migraine is an inherent condition. Migraine attacks can be triggered by various factors. The distinction between the condition and its episodic manifestations that we talked about here is crucial to understand. This is important for understanding both the pathophysiology and the treatment approach.